Good day, Dr. Chong Yen Wan and fellow classmates. My name is Lim Wei Shen, metric number 263267, and today I'll be giving my take or my view on our group assignment topic, which is COVID-19 vaccination priority. In my opinion, the first group of people who should receive vaccination are healthcare personnel. And this is a view that's supported by leading health protection agencies such as CDC, which stands for Centers for Disease Control and Prevention, and also WHO, the World Health Organization. But not only do we have to include frontliners in healthcare, we also have to look at frontliners of essential services, and this may include law enforcement, people in security, people in education, those working in supply chains, and various other frontline jobs and sectors. The ethical principle behind it is utilitarianism, which is to maximize the benefit and minimize the harm for the greater good of the population. By giving it to these frontliners, not only do the recipients reap the benefits, but also the overall population. Moving on, we have senior citizens, and these are for people over the ages of 80 with underlying conditions, because people over these ages usually have some sort of medical complication. And the ethical principle behind it is ethics of care and egalitarianism. This is the most vulnerable group towards the COVID-19 virus. And for that reason, they deserve the utmost care and attention, since they are the medically neediest ones, to allow them to live a maximal life and to reduce the mortality rates in this age group. And finally, we come to adults. These are for people between the ages of 18 to 59 without any underlying conditions. So they were if there were people who were pregnant in this age group, who have mental or physical disabilities, they are not to be included in this category. The ethical principle behind it is moral rights. While this group of people generally don't show very a lot of symptoms for the virus and are very low in mortality rates, that doesn't mean that they shouldn't be looked uh, at for vaccination, because everyone deserves to get inoculated. These are my views on who should be prioritized and who can come last. That's it for me. Thank you.
Assalamualaikum and good evening to Doctor and my fellow friends. My name is Siti Nazlaka binti Muhammad Zawawi and my matric number is 263468. Today I will give the opinion about the priority of vaccination in Malaysia. So for me, I'm really agree that government have to give a priority of vaccination to the frontliner. This is because they have a high risk to get the virus COVID-19. So as we know is COVID-19 starting in 2019, and until now it become more serious, and government take initiative to make sure the society can get vaccination. So however, government has stated that they will give the vaccination to different liners such as like police, doctor, nurse and teacher for the first. This is because as we see, doctor they have a close relationship with their patients, and teacher also have a close relationship with students. So when they get the vaccination, they can avoid from the getting the virus COVID-19. And for the society and government, they have to play a role in uh, cooperation to get the same opinion regarding the vaccination. This is because we want to make sure our society will get the vaccination and will reduce the COVID-19 spreadness. And for sure we want to stay in a positive life, in a normal norms, not like now, which is in new norm that have need to follow several of rules, such as like SOP, MCO. So we want to avoid from that. We want to make the our country is zero of COVID-19. So I'm totally agree that after give a vaccination of the frontliner, so the society also can get the vaccination. But government have to finish all the frontliner and then give it to the society later. Thank you.
Assalamualaikum and hi everyone. My name is Nura Aina Natasha binti Ahmad Halbi. My matric number is 263478. For my opinion, I agree with the government initiative for the adoption of this COVID-19 vaccine. As a Malaysian, we need to take the initiative by taking this vaccine as recommended by the government. Even there have some irresponsible parties that have been spread fake news, negative speculation, negative thought about this vaccine. But we need to be confident with our frontliners and also medical experts that have been experiment this vaccine before they give it to us. We can see like our Prime Minister take the initiative be as the first Malaysian people who take this vaccine for take this COVID-19 vaccine. We as a Malaysian need to help the government for this COVID-19 immunisation program become a success. Like we need to spread positive information, we need to spread a positive information and also persuade other people to take this vaccine. This is because if we take the vaccine, we not only can reduce the risk of infection, but we also can cut off the COVID-19 virus from continuing to spread. For example, if we take the COVID-19 vaccine, we not only protect ourselves, but we also can protect other people, especially our family members. This COVID-19 vaccine, it can act like our immunization system in our body to kill the virus, and when we show the positive attitude, positive effect, it can help to make other people take the vaccine. Even at the first, our family members are like not confident to take this vaccine. Last but not least, this vaccine is very important to all the communities, especially for the high risk group, for those who have a health issue, or for those who easy to get the infection. That's all from me. Thank you.
Hello and good day to Dr. Chong Yan Wan and friends. My name is Siti Nur Hidayah binti Ishal, matrix number 263507, and I'm going to present my very own point of view regarding to the issue that we have chosen, which is vaccination priority. So from my point of view, the first in line should get vaccinated is the healthcare workers. This is because they are at high risk of exposure. On a daily basis, they provide critical care to those who are infected by the coronavirus. So all healthcare workers must get vaccinated against COVID-19 to protect them and lessen the risk of them getting infected from COVID-19, as they are much needed in aiding coronavirus patients who are severely ill. The next in line is the productive workforce, which means the younger people uh, or working age adults and not retirees. So it is important to prioritize working age adults over the elderly. This is because younger working adults are generally more active. They travel more and they are more social. So by vaccinating more socially mobile and economically active group first, hopefully herd community can be reached quickly. They can also help to restore the economy because on these people who are on the age of 18 to 59, they consume a lot, which means they buy a lot. So they are more likely to resume economic activities such as spending and production. So this will help to jumpstart the economy. The third in line are the people who are at high risk of infection, such as senior citizens, the disabled, and those who have chronic illnesses. Although older people are more vulnerable and they are at risk of severe disease and death, they should be vaccinated in early. But in the meantime, they could still be protected by strict adherence to prevention procedures and physical distancing. This is to give prior prioritization of vaccination to a more important group like the healthcare workers who are more at high risk of exposure to the COVID-19. So, in conclusion, I believe that everyone should get vaccinated eventually. When the supply of vaccine increases, additional priority groups should be increased and should be vaccinated. So, the faster vaccination can be carried out, the faster herd community can be achieved. That is all from me. Thank you.
Assalamualaikum and hi. My name is Muhammad Nurafi bin Brahim with metric number 263615. Our topic is about COVID-19 vaccination priority. On my own view, also my personal opinion, I strongly agree with the vaccination. We as a Malaysian citizen of our country, which is Malaysia, need to support our government in order to break the chain of this pandemic issue. Even our Prime Minister also get the vaccine, and this is the symbolic of trust on the vaccination. We know that pandemic issue of COVID-19 is so much badly hit our country in many situations, many sectors like economy and social. If we want to change the situation to a better or more than before, we need to commit on it. By following the government order, we can change our life to what we want to live on the next day. There are type of people or group, maybe a community known as anti-vaccine. This type of people, they are not believe and put their trust on vaccine. This is happened due to the various type of speculation coming in and out from our country. This type of people need our support, need motivation, and maybe need more time to believe and accept what is going on in our world right now. We as a Malaysian need to support each other in order to get right from this pandemic issue. That's all from me. Thank you.